What's going on, everybody? It's Matt Piggott back here with you. We're going to be going over Naloxone. So as I kind of mentioned, you can get Naloxone kits for free at your local pharmacy, and they'll do in-house training with you there on the specific type of Naloxone kit that they're giving you. But if you want to get one for personal use, you totally can. That's fine. So for our kits in HRFE, we kind of mentioned the contents of it. So first thing we have is a 3 milliliter syringe, a blunt or draw-up needle, a foam atomizer tip, and of course our Naloxone. So for the purpose of this, we're going to be going over intranasal Narcan administration. However, just note that different styles of different kits, some of them may get you to give the Narcan or Naloxone intramuscular by an injection like an EpiPen or similar to an EpiPen, but what we typically have in our kits is going to be intranasal. So with our kit contents, the first thing we want to do when we get it all out is check to make for sure our Naloxone or Narcan is not expired. So this one, for the purpose of today's video, is good. It's not expired until October of 2025. You'll also see these plastic neck connectors on a lot of them too. That's just to protect you for when you actually break the top of the glass so you don't get cut. These can go right into the sharps container with the top of the Naloxone. So we got all our kit contents. We checked to make for sure that our Naloxone is not expired. We're ready to draw it up. So first thing we're gonna do is give the top of this a little flick, a few flicks just to get any air bubbles that may be out of there to make sure we have all the medication inside here and available. The second thing we're gonna do is we're gonna connect our 3 milliliter syringe and our blunt draw-up needle together. So it's interlock, connects, screws on. Now we can go ahead and break this open. So to crack this, you push the Narcan or Naloxone forward and you pull the top of the neck back. So it's a push back snap, like such. We can dispose of this in our sharps container, take our draw-up needle, take the cap off. You're gonna insert this on an angle like such to the very corner. You're gonna go to the very corner. You're not gonna miss a drop if you go down to that very corner. Draw up the 3 milliliter syringe. If you get some air, that's okay. Bring it right up past the 2 milliliter mark. There's only 1 milliliter of solution in here. So if you get some air, that's okay. You just wanna make for sure you're getting all of the fluid or medication out of here. So you're gonna take that out, make sure you got all the medication inside, dispose of this in your sharps container. You can now dispose of your blunt or draw-up needle. So you can twist that back off. This can go right into the sharps container. And now you're gonna put the foam atomizer tip on. Same thing, it connects in, it's interlocking, so you just screw it on. And now you're left with the medication and some air. So again, just like you did at the beginning, give it a few flicks, get the air bubbles out, push the air out of the syringe to your left with just the medication, and you should have 1 milliliter of solution or Naloxone ready for administration. Now to give this intranasally, this foam atomizer tip turns this solution into a mist. You're going to put it into the patient's nostril and aim upwards. And there is literature out there that says you can cover one nostril, give half the medication, cover the other nostril, give the other half. It's totally fine just to put it all in one nostril. That's okay. Our nasal cavity is super vascular. It has a lot of tiny blood vessels. It's gonna absorb the Naloxone very well. So to do this, again, you're gonna push in the nostril. I'm gonna show you here, zoom in and up. And then with force, you're gonna push the plunger, and you'll see here, I'll show you, it'll make a nice mist. Just like so. After you do that, you monitor for desired effects, and again, you can give a repeat dose if you need to. Thanks everybody, catch you in the next one.